Hello, welcome. I'm broadcasting here from Hamilton, Ontario, Canada. And today we have a very wet, rainy day, as will be the weather all week. In Canada, we have a saying, April showers bring May flowers. So we're hoping for those May flowers as a result of this wet weather today. So I'd like to welcome you to the panel on carer-friendly workplaces, specifically addressing challenges and solutions for a sustainable future. My name is Allison Williams, and I'm the principal investigator of the research program that we'll be highlighting today. My work has really been focused on carer-friendly workplaces, which began when I began a Canadian Institutes for Health Research chair in gender health and work. And this has morphed into an opportunity through a Healthy Productive Workplace grant, which is now being highlighted here today. So in addition to supervising a number of projects and supervising trainees, I'll be highlighting Project One, which is the internationalization of the standard. I'd like to mention that Circle is a key partner in this work. Dr. Sue Yendall is a co-applicant on Project One and has been a longstanding partner in our work addressing carer-friendly workplaces, given her strong repute in the area of care and work. So just to begin, I'd like to highlight the fact that our partnership grant is growing. We're in year 3 of a 6-year program of research with 11 co-applicants, 23 partners, 10 participants, and 36 trainees. Next slide. We are funded by both the Canadian Institutes for Health Research, as well as the Social Science and Humanities Research. And this is a new partnership between these two councils, which has really highlighted the fact that we are working in an increasingly interdisciplinary environment. As I mentioned, this is a 6-year program of research. It began with a 2-year project development grant where we actually created the intervention, which will be on the next slide. And the intervention itself is a voluntary standard. It's called the Canadian Standards Association Care, Inclusive, and Accommodating Workplace Standard. So McMaster University partnered with the Canadian Standards Association to create this tool. And it was published in 2017, the summer of 2017, and is available for free download on the Canadian Standards Association Group's website. We also created a guide, which is sort of like a handbook and provides a number of real-world case studies. So this tool, or this set of tools rather, has been the primary intervention for the overall research program. And the focus of this tool is to really mobilize carer-friendly workplaces across the country. There is the link for the free downloads. And what we noted in about year 2 of our 6-year program is that the downloads were happening, but there wasn't a lot of recognition of the actual standard. The feedback that we did receive was that the standard was a little technical and our guide was less technical, which was evident in the number of downloads. So employers and HR directors, which is really the focus of this particular program, were more likely to download the handbook as it was much more user-friendly. And as a consequence, we decided in partnership with our partner, Canadian Home Care Association, that we would create a user-friendly quick study guide. Next slide. And that quick study guide is really a 4-page document which synthesizes the standard and provides a taster, if you will, of the actual standard, the voluntary standard, and its accompanying implementation guide. And as we can see from this quick study guide, there is an infographic and some discussion about how to actually implement the standard itself through 3 steps to success. The first being to establish the foundation, the second being to put the program into practice, and the third being to monitor progress and impact. And so this is highlighted here in page 2 of the course. We have 5 specific strategies for building the foundation, including committing leaders and resources, engaging care workers or care employees at the onset, developing the policies tailored to the specific sector and size, that is workplace size and workplace sector, reviewing legal requirements and meeting social and ethical responsibilities, specific to both provincial, jurisdictional, as well as national expectations and guidelines. Next slide. Page 3 and 4 of the standard really address steps 2 and 3, with step 2 putting the standard into practice, compromising 9 specific strategies, including doing an environmental scan of the current programs through, for example, EAP, identifying gaps or opportunities, defining goals, recognizing the importance of maintaining confidentiality, building awareness piece that we've learned through both our scoping reviews available on our website. Cultural change is a critical piece. Then promoting the services, cultivating a care inclusive culture, actively supporting care workers or care employees, and then planning for the unexpected, such as a pandemic. And then finally, we have the third step, which is monitoring progress and impact, where we're, again, regularly conducting internal assessments, measuring ongoing effectiveness, and completing management reviews. And as I said, the quick study guide operates as a taster with, again, the free download links provided on the 4th page of the document. And here you have the links at the bottom of this slide. Next slide, please. In addition to the quick study guide, which is our primary tool outside of the standard and implementation guide, we have a number of additional tools that have been created by the team and by various partners. Include checklists for care workers, checklists for unions, as well as checklists for employers, HR directors, and people professionals. We also have a number of tools that look at care burden and various quizzes available for individuals who were interested in learning more about how to better foster a care-friendly workplace. So certainly we invite you to take a look at our various tools. There's also curriculum available for business schools and for HR management programs if interested. Next slide, please. So here's our program. We have a total of 14 projects. And what we're going to do today is highlight 6 of those projects in the following order. I'll be discussing Project 1, the internationalization of the standard. And then we'll move on to Project 2. And what I'll do right now is I'll introduce each of for the respective projects. So they'll have more time to present. So Project 2, Knowledge Mobilization and Evaluation of the Standard and Implementation Guide and Various Tools, is being led by Suridjan. She's the Director of Policy and Knowledge Translation at the Canadian Home Care Association and focuses on advocacy, strategic partnerships, and knowledge translation to promote awareness and discussion of family and friend caregivers across Canada. Next, we have Project 3, Supporting Work and Caregiving, Diagnosing Readiness to Change. And this is being led by Linda Duxbury, who is a professor in the Sprott School of Business at Carleton University. Her work focuses on work-life balance and employee well-being. Dr. Duxbury is regularly sought after by media to speak to these issues on the national stage. Our next project is Project 4, the feasibility and cost-benefit analysis of the standard as an intervention. And that's being led by a doctoral candidate, Regina, who's in her third year of the doctoral program at McMaster University, having fast-tracked from the master's program. Her thesis concentrates on garnering the evidence for care-friendly workplace policies via a feasibility study. Regina has been shortlisted for the Wilson Leadership Award, devoted to nurturing Canada's future leaders. Next, we have Project 8 being highlighted by Sophie Geffros. Project 8 is entitled An Inclusivity Study of the Standard for 2 LGBTQ+ carer employees. Sophie is in her second year of the doctoral program at McMaster. Her research focuses on enhancing the inclusivity of the standard for 2 LGBTQ+ care workers. Sophie has been nominated for the prestigious Vanier Canada Graduate Scholarship, given her leadership and scholarly achievement. And then finally, we'll have Project 12 highlighted, which looks at Canada's compassionate companies and their evolution and sustainability. And this will be led by Andrea Rishworth, who's a postdoctoral master. She previously held a postdoctoral fellowship at the University of Pennsylvania, and her research focuses on aging, gender and care, global health, and knowledge mobilization. So thank you again for participating in our panel, and a big shout out and much gratitude to our panelists who will be talking about their specific projects. Next slide, please. And I'll introduce our first project, Project 1, which is the internationalization of the standard. As the convener, I'd like to specifically thank Jean Bank, who is our secretary, as well as our co-applicant, Dr. Sue Yendel, who provided a report looking at a number of countries and their expectations and policy specific to the management of care work relations. And this really provided a very important foundation for the work we've been doing with the International Standards Organization. We're partnering with both ISO and association group in this work. Next slide. So here we have a project schedule that outlines where we started and where we're hoping to end. The process has generally been about a 2.5 to 3 year window. And what we've done with the international standard process is basically started with the Canadian standard, which I highlighted earlier on slide 3. And that basically provided a framework and a template for us to move this Canadian standard to the international level. After a number of different meetings, we had a working draft that was circulated for review by the working group, which is an international group of country-specific standards organizations. The draft was then circulated for review by the working group, and we were happy to see that it received 100% approval, after which we've been working on the comments specific to the penultimate draft of the standard. Once it's published, likely be in December of 2021 or January 2022, it will be disseminated through the national standards bodies of the International Standards Organization. And these national standards bodies obviously are country specific and will be using the standard as a voluntary standard, with implementation taking place in a wide variety of ways. Next slide, please. So just to give you a sense of the membership of the working group, we have a total of 17 countries involved, with the voting countries noted in blue here, including Canada and the United States, the Nordic countries, the UK, Ireland, China, Singapore, Australia, as well as Uganda and South Korea. We have a number of observing countries which don't vote, but participate in the discussion and provide critical feedback. And they're highlighted here in pink: France, Germany, Japan, and Sweden. And then we have Thailand contributing comments as well. Next slide. And here we have the table of contents, which likely won't be changing given that we've passed the draft international standards stage. What's critically important to highlight here is the care inclusive program elements, which, as you can see here in the points listed, that it's very much similar to the Canadian standard, with, again, the critical piece being worker participation, where this is a bottom-up process where care workers are involved in the creation and implementation of the standard. There's an environmental scan with objectives and targets highlighted, and then moving to actual implementation, changing the workplace culture, and finally moving to monitoring and measurement. So certainly do keep in touch via our website and our social media feed to hear when this standard gets published and be to the international community. So next, I'd like to move to our next project, Project 2, which is the knowledge mobilization of the standard and implementation guide. And I'll pass that on to Catherine Suridjan. Thank you, Catherine.
Perfect. Thank you, Allison. And hi, everybody. I'm very pleased to join all of you guys today and share my perspective from two interconnected policy domains that provide a growing range of vital care and support services to enable people to live well in their own home for as long as possible. So they are the home and community care labor force, as well as our carers. And sometimes in Canada, they are also referred to as caregivers or family caregivers. So as Allison mentioned, I am supporting the project to build awareness and understanding of the carer-friendly workplace standard among our home and community care providers. So they are our members, which include health authorities, private and non-profit service providers, as well as our community support groups. And over the next few slides, I'll be showing you some of the portraits and a glimpse of stories we heard, both from the employers themselves as well as from the worker carers, and how COVID-19 has impacted our home and community care organizations' awareness and understanding of work and care. Next slide, please. So located at the intersection of these two competing policy domains, healthcare labor force and family care work, are our double duty caregivers. So they're a portion of the health and home care labor force who double up as family caregivers as well. And I'll always remember what Susan's analogy of balancing work and care. She shared with us, it's like I'm pacing myself for a marathon. I just live day by day and try to keep going somehow. And we also heard from Salwa, who is a personal support worker, but also caring for her mother, where she reminded us that the decision to remain in the workforce is rarely identified as a choice by the care workers. As he shared, I've always wanted to look after my mom by myself. Financially, I couldn't, I needed to work. But as you guys may know, many also don't have the choice but to reduce their work responsibility or hours to make sure the person they care for are safe and well supported. It doesn't necessarily mean that they can afford it, but without adequate support, something has to give. And many of the stresses on carers have long existed. But in the uncertainty of the pandemic, it has made them even greater for carers across Canada. And whether through the rising demands and changed responsibilities or becoming a carer for the first time as a result of the pandemic, 56% of our home and community care leaders surveyed say that there is an increase in the number of care workers in their organizations since the start of COVID-19. Next slide, please. And when we first surveyed our home care leaders in the beginning of this project, so 2 years ago, they were generally aware of the trends toward their employees who must balance work and care, but not necessarily the magnitude. So while many felt that caregiving could be an area of focus in the coming decades, they did not realize that it's already affecting 35% of the Canadian workforce. COVID-19 has raised the profile of our worker carers. And from our most recent survey, it indicated that 77% say that their organization has an increased awareness of care workers as well as the challenges that they face. And the evidence is clear, and I'm sure that Many of you can also relate to this yourself. We simply perform better when we are happier. Employers' recognitions of the employee's family's life is one of the most significant drivers of employee commitment, engagement, and productivity. And the carers that we spoke to, such as Sarah and Lakeisha, provided the same sentiment, right? They shared with us that, they're so appreciative of their employers who show care, who were understanding and provided support. And it really counters the preconceived judgment that providing supports and benefits will perpetuate people to take advantage of the system. Rather, you will get a lot more from them and they will feel happier and motivated to work in the organization. Next slide, please. And we know that the visible commitment of the leadership is critical. So as part of our work to increase awareness and understanding of supporting worker carers, we also interviewed supportive home care leaders to have a better understanding of what have inspired them to become caregiver friendly. And we hope that by sharing their stories, we can influence other employers to do the same. By being a healthcare providers, our supportive home care leaders see firsthand the strain caregiving can have on family caregivers. They understand that supporting their employees create a win-win situation. So as Stuart mentioned there, by making sure that we are the flexible employers, we are not only ensuring continuity of care for our clients, but we also see our employees who do things that are well over and above. I also want to highlight Nancy's message, as we often hear organizations sometimes sharing with us that they feel ill-equipped to deal with their employees who are also caregiving, whether it's to lack of resources or other competing priorities. But what Nancy reminded us is that every little bit helps. The important thing is to start, as he has advised. Start small, start by having conversations with employees. And if people start talking about it and there's awareness, things will evolve. Our employers spoke about the programs and practices that they have implemented to ensure that their employees can lead a healthy lifestyle inside and outside of work. It is a mix of formal and informal support, and the top 3 practices are special leave, remote working, as well as flexible hours. And we also learned that in comparison to the beginning of this project, 60% say that their organizations have increased commitment from the senior management in creating a more caregiver-friendly workplace. But only 36% say that their organization are engaging staff to inform workplace practices and policies that can be used to support care workers. Next slide, please. So while employers clearly express that this is the right thing to do, they would like to better understand the business case for supporting employee caregivers in the workplace. There's significant appetite for knowledge and tools to increase understanding of caregiver needs and develop tailored solution that works for their within their context. So that's exactly what we've been doing and will continue to do in this project to promote awareness and understanding of the standard and value among our home and healthcare organizations. And I want to end by sharing the 3 key strategies that we've used to increase awareness. So one, it's important to develop a series of awareness and user-friendly materials that emphasize supporting care workers as part of a bigger picture of a human resource strategy and make it relevant to the current context. 2, we learned that it's important to also streamline the different tools to increase awareness and understanding of the issue and the standard as a sustainable solution. And 3, we learned that we also need to make sure with every tools that we created and share that we clearly emphasize the value statement and call to action so they know exactly where they can start and the steps that they need to take to become more caregiver friendly. And all the different tools that we have developed are also available on our website, which I have shared here at the bottom of my slide. And I'm more than happy to answer any questions that you may have. And I'll end there for now. Thank you very much.
Catherine. Thank you very much, Catherine. That was a great overview of our situation here in Canada. I think it's really important to note that 35% of our labor force are in fact care workers. So it's a very significant issue. And next we have Linda Duxbury presenting from the Sprott School of Business. Welcome, Linda.
Am I? There I am. Those of you who are watching probably sympathize with me, but I'm always happy when I can see my slides and I'm on screen and everything is fine. So I'm speaking to you from the nation's capital. It's actually very bright and sunny, but I have to be very honest with you. It's pollen season over here. So if I have to interrupt myself and take a break and drink water or sneeze, I hope you'll excuse me. So I'm kind of which of these doesn't belong from Sesame Street? That would be me. I teach in a business school. And part of my goal, because I heard Catherine say they want the business case to be made. The business case has been made. It's been made over and over and over again with respect to caring, childcare, elder care, sandwich, whatever. So the reality is, why are people not doing something here? And one of the best quotes that I read was elder care is the new childcare. In Canada, we've moved quite forward in terms of childcare, and it's quite accepted that childcare is something that employers need to focus on. But part of the issue is elder care is not talked about in the same way, and it's not disclosed as much. But I think that's unfortunate. So I come from a school of business. My area is not just elder care and caregiving, but the whole gamut of employee well-being, work-life balance, stress, etc. And my goal is to provide the business case for change, because quite frankly, after working in this area for close to 30 years, I can tell you that employers do not respond to the moral case for change. And they don't respond to, yes, but we'd like your workers to be happy. Quite frankly, they respond to the business case. When I did my first study, and all of these studies have between 25 and 35,000 Canadians in them. So they're quite major studies. My first study in 91 focused just on balancing work and childcare. One, because I had a young child and my parents were still very fit. And I was in the situation as a baby boomer, as most Canadians. I then moved in 2001, another national study, what can employers do? I then moved in 2011. My first focus on both childcare and elder care. 2018, another one, which resulted in a book, Something's Gotta Give, where we looked at those in the sandwich generation versus those with just elder care. And we're currently in the process of doing a really major study on work and family in times of COVID and employee well-being. And to be very honest, it's not a pretty picture. Next slide, please. Next slide. Thank you. So my role in the standards team was to look at what are the readiness to change, because actually I teach change management and I supervise a lot of research in the change management domain. I did it in partnership with the Conference Board of Canada. And in terms of my motivation for doing this is, well, why, when the data, for the love of God, why, when the data is so clear, are people just not doing something? Okay, because I don't believe the business case hasn't been made. I do believe the business case has been made. I had 67 HR executives representing public sector, private sector, not-for-profit sector right across Canada. They were amongst Canada's largest firms, all right? And we did, so if you know a Delphi study, you're supposed to bring in experts and try and arrive at the synthesis. And my goal as a change management person was try to figure out what are the drivers for change, What are the barriers for change? And then what you want to do is figure out a way to decrease the barriers, and make people more aware of the drivers. We asked 3 questions. What policies currently in place in your organization to address issues, specifically with respect to balancing work and elder care? The answer was, in these biggest firms, virtually nobody had anything formal. A lot of people thought, well, we've got all these family-friendly policies for people with kids. Surely that's good enough. But the answer actually is not. What people want for elder care, our research says, is not necessarily the same thing they want for childcare. So Catherine was mentioning flex time. Our data is unequivocal. They want compressed work weeks. They want a whole day off a week to do medical appointments, etc. We then said, what factors are encouraging you in your firm to actually address issues with respect to work and elder care? And what barriers are in place that are making you loath really to deal with this issue? So we interviewed these people, and then we did 3 rounds of surveys. Okay, the first interview, 26 forces for change, but 33 barriers. So we're already in problem area because we've got more barriers than we have drivers. So, this is quite a large study. This is my life. I got 4 slides and 7 minutes. So cutting right to, next slide, please, Xander, thanks. What were the drivers of change, okay? First of all, they talk about values, okay? But, you're going to notice a lot of cynicism, because values versus actionable items and what's put in place can quite often be different. Talk is cheap. Action is more, is more relevant. So in terms of support for elder care is consistent with our values to care for people. And the firm's focus on well-being for competitive reasons. And as somebody who studies in this area and studies in change, I want you to pay attention to this one. This one is going to get you traction. How are we going to recruit? How are we going to retain? How are we going to engage people moving forward? Because balance is a big issue. And it's a demographic imperative. We realize it's a demographic imperative. People are becoming older, etc. Okay? So if you want to make progress in this area, argue the business case. Don't argue morality. Don't argue happiness. Argue recruitment, retention, talent management, succession planning. Next, please. So, I shouldn't have put the depressing piece first. I should have done this in reverse, okay? What are the barriers? Hey, it's not a priority. And I would like to believe that COVID will make it a priority. I would truly like to believe, because our employee well-being in times of COVID study is in fact showing that more and more people have elder care. And when we said what one issue is keeping you up nights, the most, the number one was, I'm worried about getting COVID. Number 2 is the well-being of my children. But 15% of 22,000 people said, I'm worried about the health, happiness, and well-being of my parents and my elderly relatives. However, not a priority. And moving forward, money is going to be a priority in staying in business. And so we're going to have these 2 competing values. And here it is, right here. And I'm so sorry to tell you, firms don't want to incur the financial costs they see hand in hand going with addressing issues. So what does this mean for you? This means that you have to really focus on the cost of not dealing with it. Opportunity costs, go back to recruitment. Retention, go back to succession planning, saying, this is going to cost you a lot of money if you don't deal with it. Far less money than if you ignore it. So the standard, it's wonderful, it's a great tool, but it won't help if business leaders don't think this is an issue. Anyway, thank you very much. It was a pleasure to talk to you all, and take care.
Thank you very much, Linda. It's always great to have a business perspective when we're talking about the implementation of a healthy, productive workplace tool like the standard. And it's great to get a nice dose of reality based upon your very rigorous studies. So thank you very much. Next, we have Regina Ding, who's going to be talking about Project 4, the feasibility study. Welcome, Regina.
All right. Hi, everyone. So good morning, good afternoon, wherever you are. My name is Regina, and I am a doctoral candidate at McMaster University. And today I'll be talking about just some work that I've been doing regarding intervention design about the standard that Allison mentioned earlier, and specifically around the implementation of the standard within a partnered workplace with the overall goal of mitigating carer burden, enhancing care health, while also maintaining and providing benefits to workplaces' bottom line. Next slide, please. To give some context regarding my study, so my study is a pre-post test design with a pre-test and a post-test data collection phase, where I will be kind of comparing what the workplace looks like before and after the intervention is implemented. So you can see in the middle, sandwiched between the pre and post test phase is the actual rollout of the intervention. Today, I'll be speaking more specifically about kind of the pre-test results, because that's kind of where I am within my data analysis. So the pre-test was largely looking at the context of the workplace. So looking at the existence of current policies, how are employees doing right now in terms of their health and satisfaction, how are care employees doing with their burden, what is their level of supervisory support, and other kind of similar work and health related variables. The overall goal here was to use the pre-test as an environmental scan, and also a needs analysis to identify gaps within the workplace that could be addressed by the standard as an intervention. So all data was collected, via online surveys and interviews with key informants, as well as reviews of internal documents. I will kind of revisit the points I made in the intervention slides later on. So next slide, please. So our results were largely exploratory, but I'm just going to be focusing on a number of key results that we decided were more actionable and reasonable to implement within the workplace. So for example, one of the key findings we found was that carers were providing more hours of weekly care during COVID-19 than before. Specifically, about 46% of surveyed carers said that they provided more than 15 hours of care weekly. So this is, approximately the equivalent of a part-time job. About 50% of our carer sample had what is considered a high care burden on the Zurich burden score. We conducted a MANOVA comparing all outcome variables, and we only noticed that significant differences were only regarding coworker support, where carers reported much less levels of coworker support when compared to their non-carer employee colleagues, and you can see that on that plot next to there. From our interviews, we found that there was an extreme variation in family supportive supervisor behavior, where some participants said that their supervisor was, the most supportive, while others rated their supervisor the least possible supportive. So that was obviously, a key area that we honed in on. As well, we also noticed that there was overall just a low visibility of workplace supports. So it's not to say that, workplace supports for carers didn't exist within this workplace, but people didn't know where to go to access it. They didn't know, what resources were available. And this was true for both, supervisors as well as employees themselves. Next slide, please. So with these findings in mind, and with these gaps identified within the workplace, we proposed a number of changes or interventions that we wanted to see implemented within the workplace based on the Canadian standard. The overall goal of our intervention was centered around culture change, so fostering a carer supportive work culture. Broadly, we divided the intervention into kind of 3 phases that all have significant overlap. So the first phase, for example, we dubbed the build phase, which is really focused about building the groundwork for that carer supportive culture. So we created a number of tools that are posted within the intranet within the workplace. So some of the tools include tips for managers in helping carer employees. You can see a screen grab of what that document looks like. So specifically in this document, we have, safe things to say in terms of, managers discussing issues with care employees. We have tips on compassionate language. So kind of like a one-stop shop for managers in kind of providing them a guideline of how to help their care employees. For the carers themselves, we also have, a resource booklet that we constructed filled with resources not only within the workplace, but also within the community, within a provincial level and on the federal level as well. And other tools include a recognizing burnout tool and a check your knowledge quiz that assesses baseline knowledge of care employee statistics. Similar or at the same time as that, we also have a visibility campaign that we determined would be useful in elevating not only caregiver profile within the workplace, but also as a way of demonstrating organizational support for caregiver issues. So as part of our, visibility campaign, we are advertising existing supports within the workplace because this workplace that we're working with actually does have a number of carer-specific supports. We also drafted and created a number of promotional posters or flyers filled with a lot of Canadian carer statistics, just as a way of, getting that information out there to the general employee labor force. And we do have a push to get managers and supervisors and team leaders to discuss carer issues, but also carer supports at department meetings, town hall meetings, and other types of meetings, such as occupational health and safety meetings. And again, this really serves as demonstrating organizational support for these issues and hopefully move the workplace towards a more kind of carer supportive work culture. And the last phase, what we're calling it the hard touch intervention, is the actual training and education of the workforce. So we have two kind of training sessions. One, we have what we call the standardized training of managers. So it is it's a mandatory training session where we have demonstrate and we have a specific set of lessons plans and statistics that we present to managers in order for them to be more aware of care issues, as well, just learn how to be more compassionate towards the care employees. And then at the same time as that, we are hosting educational seminar series and lunches and learns, mainly focused on educating the general population or the general workplace population about care specific, issues, statistics, but also solutions. So at this time, I'm currently in the midst of the education phase where I'm carrying out the actual, manager training and seminar series. This data collection is projected to end at the end of the month, where we will be conducting the post-test intervention. So with that, I'm done my presentation. Thank you all for listening, and I'll move it on to the next speaker. Thank you.
Thank you very much, Regina. It's nice to see the progress that you're making with this work, and certainly recognize the intensive experience that you yourself are living in doing this really hard work of not only carrying out the intervention, but testing its feasibility from both an effectiveness and a cost effectiveness perspective. So great work. And next we have Sophie Geffros, who will be speaking about her research, which has literally just got off the ground in the last month with respect to the data collection phase. Go ahead, Sophie.
Wonderful. Thank you so much, Allison. Good afternoon, everyone. As we mentioned, my name is Sophie Geffros from McMaster University in Hamilton, Ontario. And today I'm going to be speaking a little bit about my project entitled Coming Out to Care, an inclusivity study of the Care Inclusive and Accommodating Workplace Organization Standard. So I look specifically at the experience of carers who are members of the two-spirit, lesbian, gay, bisexual, transgender, and queer communities, or who otherwise possess a non-heterosexual sexual orientation or a non-cisgender gender identity. And today I'm actually going to give you some background on the care dynamics we typically see in this population, and consider how the standards my colleagues have discussed can best be applied. Next slide, please. So to back one, there we go, back. back, great, okay. So to understand 2S LGBTQ+ carers, we actually first have to understand the population which forms the bulk of their typical care recipients, which are 2S LGBTQ+ older adults. And as the population of older adults who identify as members of the 2S LGBTQ+ community, and it is expected to double between 2015 and 2025, we will see an increase in the need for culturally sensitive care supports for both them and their carers, as the most common carer for a 2S LGBTQ+ older adult is a fellow member of the 2S LGBTQ+ community. So these older adults have unique care needs. They are much less likely to access state care due to life histories, which include systemic and medical discrimination. They are more likely to experience early onset aging-related frailty, have higher rates of modifiable risk factors for dementia, such as a substance use disorder, and are much less likely to have a primary care physician than cisgender heterosexual older adults. And the care needs of this population are often poorly accommodated by state care for a few reasons. The first being that, as I just mentioned, they are much less likely to access it in the first place due to life histories of medical and systemic discrimination, as well as significant traumatic experiences associated with the HIV/AIDS epidemic of the 1980s and 1990s. This population also lived the bulk of their lives without legal protections. Marriage equality has only become widely available in Canada within the last 15 years, and within the last 5 or 6 years in the United States and the United Kingdom. As a result, many 2S LGBTQ+ older adults are unmarried, although they may have long-term partners. They are also significantly less likely to have adult children to care for them. Discrimination in adoption throughout the 20th and 21st centuries has meant that adopting children was simply not a possibility for many 2S LGBTQ+ older adults. And those 2S LGBTQ+ older adults who did have biological children were systemically discriminated against in custody proceedings. As a result, this population often lacks access to the typical carers for older adults. Lacking adult children or legal spouses, they instead rely on fictive kin or chosen family relationships. Community care is highly valued within this community, but these care dynamics are rarely recognized by the state, and as a result, most of these carers are ineligible for state supports. Next slide, please. This is why workplace-level interventions like the standard are so important for this population. For many, this is the only level at which these carers can access support. As the most common carer for a 2S LGBTQ+ older adult is a fellow member of the community, usually 5 to 10 years younger than the care recipient, these carers are situated in the same age demographic as the general carer population. They are typically adults in their 50s and 60s, who maintain paid employment while providing care. The standard is vital, but steps must be taken to ensure that it is culturally competent for this population. Because 2S LGBTQ+ carers and their care relationships may not fit the general understanding of what an informal carer is, without explicit protections or accommodations codified within the standard, they may find themselves unable to access accommodations to which they are entitled. Next slide, please. My project, which is currently ongoing, is an inclusivity study which takes a pre-post intervention design. At present, I am engaged in a national online survey in Canada to assess the experiences of these carers at a national scale. I am particularly interested in how workplace-level experiences of discrimination based on sexual orientation or gender identity may impact the ability of these carers to access accommodations, and how the intersecting oppressions they experience may impact their quality of life, quality of work life, carer stress, and self-reported health. I am also initiating online focus groups throughout Canada over the next few months. As 2S LGBTQ+ identity is strongly place-bounded, we know that the resources and community support available for 2S LGBTQ+ carers will likely show significant geographic variation, even within the same country. These focus groups will engage in community co-design of modifications to the standard, such as that we can ensure that it is culturally competent for this population. Phase 2, which is expected to commence in September of 2021, will involve partnering with workplaces at 4 sites across Canada. Partner worksites will agree to implement the modified standard for a period of 1 year and to engage in ongoing monitoring. These sites will be selected with an eye to the differences between sectors, the impact of union status, and geographic variation. The final phase will involve the development of culturally sensitive tools for managers to support their 2S LGBTQ+ care employees, as well as a video project which will highlight the experiences of these carers. The importance of the standard for this population is hard to overstate. There is a deep need for these resources within the community. And unfortunately, to date, the 2S LGBTQ+ older adult population and the 2S LGBTQ+ carer populations have been largely invisibilized in gerontological research, caregiving research, and queer studies. This is a largely ignored population. And at the heart of this project is the aim to improve supports for this population, as well as its visibility, in order to remedy the epistemic injustice that has been historically inflicted upon the 2S LGBTQ+ community. Thank you for your time. That concludes my presentation.
That's a great presentation and a wonderful study, as it really stretches the envelope on our understanding of care workers. So wishing you the best of luck with that work. Very exciting to see. And our next speaker and our final panelist is Andrea Rishworth, talking about the Canadian Compassionate Companies Program. Thank you, Andrea.
Hi, good morning. Good morning or afternoon, wherever you are in the world. My name is Andrea Rishworth, and I'm a postdoctoral fellow at McMaster University, working with Dr. Allison Williams. My presentation today centers on Canadian compassionate companies and explores opportunities and barriers for their sustainability. So in 2018, approximately, next slide. And next point. Thank you. So in 2018, approximately 7.8 million Canadians provided care for a family member or close friend, many of whom were suffering with a palliative health condition. 6.1 million of these care providers were also juggling work responsibilities. So these dual responsibilities not only increased absenteeism and turnover rates in companies, reduced employee engagement, and delayed career advancement, but also contributed to poor health and well-being outcomes for both the caregiver and the receiver. So a palliative care approach is identified by the World Health Organization as a strategy to improve the well-being of both the caregiver and the receiver through accessible, integrated, and patient family-centered care and support. By considering the needs of both the caregiver and the receiver through a holistic health framework, a palliative care approach can reduce the burden and burnout of employees, improve employee retention, shrink the need for intensive care, and improve the quality of life of both the caregiver and the receiver. Next point. Thanks. So despite the benefits of the palliative care approach, few workplace policies and programs exist that support care employees in a comprehensive manner. Next point. So to address this gap, the Canadian Hospice and Palliative Care Association, or the CHPCA, which is the National Voice for Palliative Care in Canada, developed its Canadian Compassionate Company Program, or CCC program, to recognize companies with policies that accommodate caregivers. So the idea behind this policy, or this program, is that companies must meet 3 of the criteria identified here, such as provide job protection while on a care leave, provide flexible accommodation policies, or promote advanced care planning, pay a $300 registration fee, and go through a particular assessment. So if the company is deemed care-friendly, they receive the CCC designation and pay a $100 annual renewal fee. And with this designation, they get access to listservs and newsletters, marketing, and events. So currently in Canada, there are 18 organizations which are considered CCCs, and the CHPCA is hoping to expand this program throughout the country. Next point. So this research comes in at this junction and partners with the CHPCA to examine the motivations, benefits, and challenges of being a CCC organization. Currently, I've conducted interviews with managers and HR executives from 4 CCC organizations, 2 of which are larger companies with approximately 800 to 1,000 employees, and the 2 others are smaller companies with around 30 to 60 employees. So the results that I will discuss in the next slide are preliminary findings from this research and all have been transcribed and thematically analyzed. Next slide. So when employees were asked of their motivations to become a CCC, participants discussed the ease of CCC application and how it affirmed their status as a care organization. A participant states here, we already promoted compassion internally and we had all of these supports. So the CCC designation solidified our purpose and highlighted our care. But the CHPCA criteria isn't tough. It's kind of an insult to people, like we do all these things, but other companies don't. Next point. So when employers were asked about the benefits of being a CCC, participants often discussed intrinsic factors related to cultural change, other than extrinsic benefits like monetary gains. So as the participant states here, it's not so much the extrinsic benefits, but the intrinsic benefits. It's meaningful to people. It gives them a sense of comfort to know if they need a leave of absence, we support them. I don't see the benefits in terms of the CCC status, but what the support does for the staff. We have a highly engaged team. Next point. So when asked about the challenges of being a CCC, participants indicated how pre-existing organizational challenges were being exacerbated under COVID-19. As the participant states here, with the CCC designation, there are limitations in how we can expand financially. We're growing at the same time we're applying care policy, so it's very challenging. Resources were tight, and now with COVID, the compassion companies has gone flat. But it's a really good example of why we need this approach right now, because people and companies are struggling to do the best they can. Next slide. So while these findings indicate many challenges for CCCs, they also point to many areas and opportunities for sustainability. So first, there's the need to consider if the criteria to become a CCC should be tightened and potentially limit the CCC pool, but attract organizations that promote good quality care, or keep the same criteria and potentially attract more CCCs, but lead to limited change for organizational care. And second, the results suggest that while the CCC status is necessary to support a particular standard of organizational care, it is insufficient to enact long-term organizational change necessary to support employees. As my participants indicated, becoming a CCC was often quite easy and driven by a pre-existing desire to support care employees. And lastly, the results suggest that CCCs are strained to sustain and expand their care policies that they're required to provide under the CCC designation. So given that these companies receive no financial support through their CCC status, yet are expected to provide a certain level of care, they experience many challenges which are now being aggravated due to the COVID-19 shutdowns. And so while this was more of a challenge for the two smaller organizations in my sample, it was clear from current interviews that COVID-19 is intensifying the capacity of both carers and companies to effectively care, and in turn creating new ambiguous care environments. So moving forward, I will continue interviewing care employees and employers of CCCs, and I have also scheduled a series of webinars to mobilize knowledge in order to sustain care-friendly environments. So thank you for your time.
Great, thank you very much, Andrea, for presenting on that very innovative work. The Compassionate Care Companies is a new innovation in Canada that is only going to increase and grow over time. So great to have that, that piece of work presented. Thanks very much. So the next part of our panel is specific to asking directed questions to our panelists, and we do have a few that are currently on our list to get us started. But we certainly encourage the audience to share any questions or comments in the chat box. So when we get through these listed questions, hopefully we can engage in your specific questions. So our first question is for Catherine Suridjan. Catherine, you spoke about the impact of COVID on care employees, about the importance of building the business case to support worker care employees. And my question to you is whether or not you feel the impact of COVID will in fact bring about long-term institutional change with respect to supporting worker carers going forward. Thank you.
Yeah, so in terms of through our survey of home and community care leaders, there's definitely appetite to create more caregiver-friendly workplaces. As I mentioned, they see firsthand the impact of caregiving on family caregivers. They also starting to recognize that the source of the organization's productivity is the diverse talents and commitment of their employees who get things done every day, who deliver outstanding services to their clients. So they recognize that accommodating their employees to ensure that they can balance work and care, it doesn't inhibit the organization, but it's actually crucial to its success. But some of the challenges that they're having now with COVID is that, as Linda kind of mentioned, is that they feel that sometimes there's so many competing priorities, and there's also some of the misconceptions that providing support to their employees could be a high resource interventions. And through COVID-19, we also learned that a lot of to address the ongoing HR challenges, as well as need for quick responses and rapid communication to their front lines. Many home and community care organizations have implemented a decentralized approach in managing HR. So instead of one corporate centralized team, they're looking at multiple local branch managers taking on the HR responsibilities. So I think that's where we have seen a little bit of reflection in our survey, with more of the HR, more of the leaders showing commitment to support their employees, and also having more appetite to learn more about how can they better support their frontline workers.
Wonderful. That's great. Well, good luck with that. Let's hope it proves to be effective. Next, we have a question for Linda Duxbury. Linda, you mentioned that COVID may change employers' approach to career-friendly workplaces with respect to potentially being a little more interested in bringing about the important culture change that's required. So what are your predictions with respect to whether career-friendly workplace practices will or will not be on the rise post-COVID?
I think everything is up for grabs right now. I think that anybody who's making predictions today will probably change them next week. I think we can with certainty say that the government of Canada will definitely, and the government of Ontario will definitely do something about people who are living in nursing homes, facilities, etc., and upping the standards for the kind of care they get once they're institutionalized. But that's a different matter, isn't it, from employers? And in terms of employers, I think many of them, and I'm sorry to be so cynical here, but many of them are concerned about viability first, and then, but if we make the case to them that viability is linked to attraction and retaining people, then in fact, you're probably okay. But we've been doing a lot of interviews. We've been interviewing since March 2020 on the whole issue of employer support. And many people in Canada anyway say my employer is verbally supportive. And HR is constantly sending around lovely messages. But the reality is they expect me to be available 24/7 and answer the emails. And so that's the whole issue of organizational culture. So in order to be able to make significant change, we have to change the things that change culture, which is the reward and recognition scheme, promotion scheme, all of those kinds of things. Do I think it's going to happen? I think the smart companies are going to do it. I think other companies are going to focus more on survival. Mm-hmm. Sorry.
Yeah, no, I appreciate your transparency there. And I'm just curious from your perspective, the size of the organization as well as the sector of the organization, does that bring about variability at all with respect to how companies may in fact respond?
So again, the government sector has amongst the best policies that you'll ever see. Their practices don't align with their policies, okay? So that's the whole idea of organizational culture and the idea of saying no to being available is going to be a career limiting move. We find the not-for-profit sector which you got to feel sorry for because they're struggling, they have no secure funding, etc. But not surprisingly, they're the most compassionate of their employees, but that's putting them at risk moving forward because they're giving their employees all kinds of benefits and trying to be supportive, and the burden is actually going on people without care. So kind of an interesting side effect. A lot of people are talking about mothers and a lot of people are talking about caregivers, but our data is unequivocal. Single women without dependent care actually has the highest levels of stress. And private sector, it's all about showing them that it's linked to the business case. You can show them it's recruitment, retention, succession planning. The problem, again, and I'm sorry, I'm giving everybody as complete a view as possible. The problem then is they're going to give those benefits and do something for one pool of employees that they want to keep. And there's fewer incentives to do those same things right across the company. Mm-hmm. So a complicated issue and a complicated answer. Sorry, Allison.
No, that's fine. That's fine. I just noticed we do have a question from the audience, so I'll hold off further questions for Regina, Sophie, and Andrea. The question is from Dr. Sue Yendel, who asks, many of the interventions and supports that we've spoken about are voluntary for employers. Can you update us on how Canadian governments at national or subnational levels are engaging with this agenda? Is legislative progress, re-caring and work likely? So I'd like to send that out to the panelists. Anyone interested in attempting to answer that question? So I can give it a shot, and then if another panelist is interested in responding. Oh, Catherine is up.
Yeah.
Okay. Yes, certainly.
I'm happy to share some. Yeah. Yes. And hi, Sue. Nice to reconnect with you. So in Canada, the Canadian law, actually, there's a law that prohibits discrimination based on a person's family caregiving responsibilities. So we have some, caregiving benefits available through the federal employment insurance to support family caregivers with a job protective leave when they need to take time away from work to provide care or support to a critically ill or injured person or someone needing end-of-life care. And then at provincial and territories level, they also have adopted some of this compassionate care benefit and the job protected leaves. But what we don't have in Canada is a national, until this work that Allison is doing, a standard to support, to create some kind of consistency in terms of the type of supports that are being provided to our worker carers. And then through COVID-19, our government has provided the Canada Recovery Caregiving Benefits, and they have also made some adjustment in the EI caregiving benefits that the waiting period may be waived, need less insured hours, and etc. But then, as you know, right, it's not just about the financial and the security, but it's also all about that support and within the workplace itself. So I'll stop there for now, and then I'll add Linda. I'll have Linda add stuff.
Great, thank you, Catherine. Linda?
So Susan, it's quite complicated because you've got a whole bunch of players in the game. What I do think, and all the discussion from our Liberals who are at the federal level are most likely to get back in, though who knows, they're talking childcare. And they're talking a lot of money in childcare. I see Allison shaking her head, a lot. And a childcare agenda right across the country. I have not heard one word at the legislative level, in any province, at any at the federal level, in terms of caregiving. Where you do hear, as I said before, is they're going to invest and have legislation around care facilities. Okay, but that's not the same thing as requiring caregiving, and our government is kind of loath to tell employers anything, because we have certain provinces that will go crazy if they take the federal hammer. So it's very complicated. Britain's so much easier. You've just got one government. There you go. But Canada, no.
Yeah, that's right. It's a little bit more complicated over here with our various provincial jurisdictions and our territorial jurisdictions. I do have a new master's student who has a background in the legal profession, trained and working as a lawyer, who's interested in specifically analyzing case law decisions to determine any patterns arising from levels of success by applicants who are applying for human rights. And he's using content analysis to basically look at the human rights codes of both the federal government as well as the provincial governments across the country to determine if, again, human rights is in fact being used successfully with respect to, as Catherine mentioned, the right to care. So it is in fact recognized in both national jurisdictional legislation, but it's very rarely actually upheld. And so it's by reviewing this case law that we'll be able to determine how much success carers in fact have had in going the legal route to determine whether or not they in fact get compensated either monetarily or through job security or potentially through the implementation of carer-friendly workplace policies within their workplace. So that work is ongoing, but sadly the legislation is not not being followed as it should. And it is, potentially, I'm sort of seeing the work we're doing here in Canada with respect to care workers as sort of the early days of where we were with the maternity leave benefit, which is now expanded to paternity leave, as well as extended from a few weeks through to a full year. So the evolution of the maternity-paternity leave benefit provides a potential template for what we may see happen with our compassionate care benefit, for example, or with other workplace support programs that may in fact be available in the future. And I'm talking, potentially decades from now. All right, so not seeing any further questions from the audience, we'll move on to Regina with respect to a specific question to her around her feasibility study. And so Regina, the question is whether or not you're able to elaborate further on how COVID-19 has impacted your intervention. Has it brought the whole issue of care workers to the fore? Do you think it may, in fact, impact long-term institutional change? What are your thoughts there?
I mean, that's a very big question, just because I feel like COVID-19 has almost encapsulated my intervention. So for a bit of context, the original study was not designed under COVID conditions, and a lot of my research had to pivot very last minute in order to accommodate, COVID-19. But that allowed the addition of several, COVID-specific variables, which was almost a bit of a blessing in disguise in terms of how COVID has, affected some of my findings. Obviously, in a lot of the interviews that conducted, COVID-19 was a central theme that was brought out specifically in kind of Canada's case. Canada had a lot of long-term care outbreaks. And then because of that, a lot of my participants were speaking about the idea that all of a sudden, so my participants, they either, took out their care recipients from the workplace, or not the workplace, from their long-term care homes, and were now caring for them within their home. Or, they're still in the long-term care home, but now there's a lot of anxiety about that. So a lot of, findings specific to the care employees were talking about how with COVID-19 that the home is now not only a site for, living, it's also a site for working if people are working from home, and also a site of caregiving now. So there's a lot of additional pressures that a lot of the caregivers in my sample were talking about in terms of, never being able to fully recharge, because there's always there's almost that layering of multiple roles going on within their home that they can never escape from. Accordingly, that's one of the reasons why we think, the zero burden score or their overall burden score was quite high, because carers weren't able to differentiate that in terms of, the actual workplace response in terms of COVID-19. So I did, interview several managers and supervisors about that as well. And some of the questions were very specific to COVID-19. In general, I would have to say that, almost as a silver lining, COVID-19 has thrown the idea of caregivers almost at the forefront of all these managers' mind. And now keep in mind, I believe of the managers I interviewed, only one of them had experience being a caregiver themselves, and then the rest of the managers had no prior experience or personal experience being a caregiver. But a lot of these managers were like following the news about what was going on in terms of the long-term care home, how people are managing that. So I would say that as the silver lining, all these care issues are much higher or more in the forefront of a lot of these, key players in the workplace's mind, which ideally, should increase the profile of these caregiver issues. I think it probably has played a role in kind of the rollout of my actual intervention, is that, these care issues, these care and long-term care issues are a big problem in Canadian society, especially in COVID-19. And because of that, I would have to say it's almost lucky that my intervention is being rolled out at this time when so much of the public is discussing, issues regarding caregiving.
Mm-hmm. Wonderful. Well, thank you very much for that. And so, Sophie, a question for you. Do you feel that the needs of 2S LGBTQ plus caregivers and other marginalized caregivers overlap?
Yes, absolutely. So a thing that I think is really important to understand is that when we talk about these unique care structures that we see in 2S LGBTQ communities, we see similar care structures in some Indigenous communities and in some migrant communities. The idea of your family being not just the people who are directly related to you in your nuclear family, but being people who you are friends with, who you are in community with. These care structures are poorly reflected in our legal understandings of care and in our institutional understandings of care. But I think that that's sort of the key similarity, I would say, is these unique care structures. And I think what's really important to understand is that by making things like the standard responsive to the needs of 2S LGBTQ plus carers, we also make it more responsive to the needs of all kinds of carers, of migrant carers, of Indigenous carers, of carers who are generally poorly accommodated. And then the other thing I think is important to understand is sort of the impact of economic disparity, right? One of the things that we do see in the LGBT community is a slight overrepresentation in precarious service jobs, something which in conversation with people who do research with immigrant carers, you see this very similar thing where we're talking about populations who don't work in, the professional sort of high road employer settings where we're most likely to see these kinds of interventions. They are marginalized, and as a result, things like the standard can be really key for people who are already dealing with inequities of access to all kinds of things. So I think that there are some really important similarities, and by making it better for one of these populations, we make it better for all of these populations, is what I would say.
Thank you very much, Sophie. That's a really excellent point, particularly around the interlapping intersections that many care employees experience. And we do have another study, Project 5, looking at Indigenous and immigrant care workers in Canada. So it'll be really interesting to see what kind of results they come up with and how they may, in fact, intersect with your work around to LGBTQ plus care workers. So thank you for that. And so our last panelist, Andrea, I also have a question for you, if I may, and that is what can other care organizations learn from the Compassionate Care program? Is there anything that this program allows other organizations to potentially implement? Thank you.
Thank you. I think that's a really good question because the more I do research with CHPCA, I learned that there are numerous gaps in this organization and how they're implementing the CCC program. So I'd say first of all, if other care organizations were to do something similar, I think they need a clear vision, goals for the particular program, and then a strategic plan about how to move these goals and aims forward, and have targets that are both short and long term, because currently the CHPCA, they have an underlying vision of how they want the CCC program to be, but there's nothing written in stone of how this should actually function. There are no short-term or long-term goals. So I think if companies are to, or if care organizations are to do something like this, I think that they need to be very clear and articulate in how they want this program to be structured, and then create clear metrics and ways to monitor the progress of these of this program over time. So they're able to see, are we meeting our goals? Are we meeting these standards? Where are these gaps? How can we potentially modify this and alleviate these challenges for the carers and care employees? Because if they're not monitoring or have metrics to track changes over time, we're not going to know if there's been any improvements or if there are significant gaps, or are we making any progress? And then another aspect as well, I think there needs to be proper oversight of the CC, or of a similar project like this, because after companies have this designation, they're kind of left on their own and they don't really receive a lot of engagement with the larger CHPCA body. So if other organizations were to do this, I think providing regular interaction would be very helpful, because that was something that came up in a lot of my interviews, that they wanted, the CCCs wanted to be connected to other organizations, other CCC organizations, so they could learn across organizations and kind of co-develop policies and strategies to promote employers in a most effective way. So they're not left on their own, and are we doing the right thing? And to share and kind of integrate the knowledge that way to improve the sustainability of care policies and supports. So that's what I would say.
Okay, that's great. Thanks very much. Yeah, there's nothing like networking to learn effective and sustainable strategies for, again, engaging and sustaining care-friendly workplaces. So we have a couple of polls that we'd like to share with the audience. We'll start with the first one, which reads, which of the following does not represent a global force supporting flex work? And the options are A, rapid development of telecommunications technology, B, fewer limitations to the typical 9 a.m. to 5 p.m. workday, C, increased adoption of strategies to ensure work-life balance, and D, an aging workforce. So which of the following does not represent a global force supporting flex work more than the others? So we're just waiting for those answers to come in. And certainly still more than keen and interested to hear the audience's questions for the panels, either specific panelists or more universal questions to ask the whole panel in totality. Certainly do share those, and we'll do our best to answer them. Okay, so the votes for the polls are coming in, and it looks like most people are responding to B and C, which is fewer limitations to the typical 9 to 5 workday, as again, not representing a global force supporting flex work. and C, which is an increased adoption of strategies to ensure work-life balance. So I'm going to bring Regina Ding in here and ask her to speak to this particular question in order to provide a little bit more elaboration on again, the global forces that are supporting flex work. Thank you, Regina.
Yeah, so overall, the issues of carer employees, they're very multifaceted. There's a lot of kind of social demographic changes associated with the carer employee phenomenon, and accordingly, there are a number of, forces that can contribute to the solution as well. In terms of, first option, rapid development of telecommunications technology, especially within the past decade, we've seen huge, advancements in all areas of technology, and especially with telecommunications technology has certainly, been a blessing for a lot of workplaces, especially during the pandemic. Ideally, we should see, the continual usage of these telecommunications technologies after COVID-19. And this is especially helpful for carers because this helps give more freedom in terms of their schedule if, they're able to telework, work from home, flex work. So generally, telecommunications technology is, a huge benefit in terms of flex work and in terms of carer schedule control, because it just gives a little bit more kind of control back into carers' lives in terms of, organizing their day, organizing medical appointments, transportation appointments, stuff like that. And this is associated with option B, which is fewer limitations to the 9-to-5 workday. So accordingly with that, we have rapid globalization. Businesses are not strictly occurring in the 9-to-5 intervals anymore. And a lot of workplaces have recognized that, specifically within certain industries, work objectives are now more kind of project or objective based versus, that strict get in at 9, leave at 5, whatever work you gets done. And certainly, that's related to telecommunications technology because you now have more kind of freedom via technology to expand your workday past that 9-to-5. Certainly that is useful to many carers who, again, they can recontract their workday. They can either start later or end later. They can take a break in the middle to take their care recipient to a doctor's appointment. So certainly, having less limitations on the 9-to-5 workday is a benefit to care employees. The option C, so increased adoption of strategies to ensure work-life balance. That's also a huge benefit to carer employees as well. I believe that is the correct answer for the poll as well. So a lot of companies globally, there is incentive to ensure work-life balance for their employees to prevent burnout, higher productivity, better work-life satisfaction, and retention of their employees. If they have a manageable work-life balance, they're much more likely to stay employed within the workforce. And obviously, that last option, aging workforce, globally, the population is aging. And certainly that is a huge kind of push for having that flexible workplace, that flex work, because, being a caregiver doesn't occur strictly post-work hours. If you have your care recipient fall over, have a medical emergency, it's not appropriate or it's not realistic to finish your workday before addressing those care needs. So certainly as more of our population ages, and I believe it's something like there's over 1 billion seniors over 60 right now. So certainly as that kind of proponent of the population grows, we're going to need more and more, or we're just going to see more and more incentive for that flex work option.
Mm-hmm. Mm-hmm. Excellent. Thanks very much, Regina. Certainly, we are also, particularly in the industrialized West, seeing increased longevity in our elderly and an increase in, again, the expectation for families to bear the role of caring for this increasingly dependent population, given, again, multiple comorbidities. So, the writing is on the wall that there is going to be a demand for carer-friendly workplace policies, whether or not, again, workplaces step up and make them available is one that, we continue to press and work towards. So we have another poll currently being asked, and that is, what are the costs to the employer for not supporting care workers? And this is really something that Linda Duxbury was speaking about with respect to opportunity costs. And the 4 options are A, absenteeism, B, increased turnover, C, delayed career advancement, D, reduced engagement with the workforce, and E, all of the above. So we'd be interested in hearing the audience's response to what are the costs to the employer for not supporting care workers. And I'd like to call on Linda Duxbury to respond to the answers to this poll, if she'd be kind enough to do so.
Hi, everybody, again. All of the above and even more. It bothers me, and I'm sure it bothers all of you, that we actually have to talk about this in terms of costs and money. But the reality is, for many organizations, they would be very clear, we're not in the business. The most important thing for us is staying in business. So we have to show them that there are significant costs, and we can do it with all of those tools and more.
Mm-hmm. So another one that I noticed was missing in that list, Linda, as you had mentioned, these and more, is the whole issue of presenteeism. Can you just speak to that issue, please?
It's interesting you bring that up, because everybody focuses on absenteeism, but presenteeism actually costs companies more. The data is quite clear, because if you go in when you're unwell, especially if you're mentally unwell, it actually contributes to greater problems over the long term. And if you're physically unwell, you can share your disease with your closest 150 colleagues, as we're seeing in many workplaces where people are going in during times of COVID. So there's 2 reasons people do presenteeism. One, because they need the money, they need the job security, and they're afraid that if they actually take the time off work, they're putting themselves in risk. And so that goes back to the whole issue of the culture of the organization, where organizations talk about taking time off if you need it, but they're understaffed. You'll let your colleagues down if you don't come in. So there's many factors that drive people to attend work when they shouldn't, and it's a real problem. So we should have put that on that list, Allison.
Thank you. Yeah, I often have to actually define presenteeism when it's on a list like this. So I'm really glad that you provided that excellent explanation, Linda. Thanks very much. So our next poll is specific to barriers at work. Which of the following represent barriers at work? A, lack of managerial support. B, lack of employer awareness. C, lack of work culture. D, all of the above. And if possible, I'd like Catherine Suridjan to attempt to discuss this particular question. Which of the following represent barriers at work? Thank you, Catherine.
Well, I would say all of the above. And I also want to add to that multiple choice, also it's the lack of the employees' awareness as well in the type of supports that are available, or feeling that they know someone to reach out to. I also want to bring the idea of, with our work, looking at double duty carers. So there are even nuanced challenges that they're experiencing as they're healthcare professionals juggling caregiving at work and at home. So they're at immense pressure and stress as they are in the front lines to fight against the outbreak. and then compounded by the fear that they might inadvertently carry the virus home and infecting their family members or neighbors. So a lot of them would even turn down job altogether to avoid the risk. And when they don't have that options and they continue to try their best to balance the work and care, our double duty caregivers are essentially working shift after shifts without ever being replaced. And then as the boundaries between caregiving roles become blurred, they are at higher risk of developing symptoms of overload and burnout.
Excellent point. And that's exactly what we're trying to prevent here with the standard and the associated tools, is prevent that burnout from happening. I see we have one final audience question that we'll squeeze in before the session closes. And I'd like to thank all the panelists and the audience for participating in this, as well as the Circle community for organizing and keeping this conference running so smoothly. So the question, which I'll ask Sophie Geffros to answer, is what is the state of employee voice in Canada? And how does it influence the implementation of these standard policies? Thank you, Sophie.
Sure. So an important thing to note is that the labor union rate in Canada is actually quite significantly higher than in both the US and in the UK. It's about 38% in Canada. In the UK, it's about 27%, and in the US, it's about 13%. And one of the things that we do know is that unionized workplaces are more likely to adopt these kinds of policies. We've worked in partnership with labor unions in the development of the standard, including Unifor, which is the largest private sector union in Canada. My project is also working with several large public sector unions. This is really good for the adoption of the standard because it means that the standard can be adopted not just by workplaces, but by labor unions in their collective agreements. And we actually have developed some tools for labor unions as they're developing their collective agreements to ensure that they appropriately address the concerns of their care employees. So I would say it plays a huge role. And I would also say that we have the barriers that we see to implementing things like the standard are likely a bit higher in non-union sectors, simply because we talk about low road and high road employers a lot, and unionized workplaces are more likely to invest in their employees, and their labor unions are more likely to push employers to adopt things like the standard to appropriately support their care employees, versus in non-unionized sectors where it can be significantly more challenging. So.
Yeah, great point, Sophie. And I think, our unions are really our partners in realizing the standard moving forward. So really appreciate you commenting on that. So we are on the last minute of our panel. And I'd like to, again, thank our panelists for the time and the attention that they gave to not only their presentations, but also the questions and the polls. Thank you again to the Circle team for keeping us on time and organized. And thank you, audience members, for your attention and participation. Enjoy the rest of the conference, everybody. Take care. Bye-bye.